There's a bulletin has gone out. It has a lot of new information in it. In particular, there was a new law passed at the end of last year and was approved by the board in the middle of the summer, and it's around food allergy. We kind of preempted it last year by sending out an H2 around mid-year around food allergy to collect information, even though we didn't have at that time all the nuts and bolts of the new law. But we do now. And so that information is in the bulletin for you to read. The bulletins will be posted on the website. And I know you're familiar with getting pop-ups from IT department that says something is new on their website, right? Okay, we're going to do the same thing. Rather than sending out a bulletin with all of its attachments, because we often get feedback, people can't open an attachment or something like that. So you will receive it today in that same format, and it will go into the web. But after that, you will need to go to our website in order to look at the bulletin. Now, you as adult learners are responsible for any memos, bulletins, or anything on the district website or health services website. Any information at those areas, you are responsible to know. There is a new process in town. This may be the last time we meet in this type of venue. The directive was given to department directors and executive directors that no staff will be pulled from the building anymore. And you may have experienced that even today. Principals may have asked questions, do you have permission to leave campus today? Because in reality, other departments were not granted that permission. But we were for this one event. Our new nurses have just finished new nurse orientation this past week and this week. So they were granted that permission like new teachers to continue on with that process. But in the future, when we communicate with you with new information or with updates or anything else, it will be done by remote. So that could be webinars, it could be a Moodle training, it could be a plain PowerPoint, or it could be a memo or a bulletin, etc. So your learning as an adult learner will become remote, and it will be your responsibility to get that information and consume it. Because you couldn't open something is not an excuse. You are to figure out how that is to be, how's that to happen, and you proceed forward with learning that information. Today I will be presenting delegation for you. And we will talk a lot about what is online and what is available to you. So that is another resource. When we give a link to something, then it's something for you to read or see or scan, just to know that you have that information available at a click away. Be sure and go. One of the first things you will want to do is, of course, go to the district website. On the website, on the left side of the screen, is Destination 2020. That is the superintendent's philosophy and direction for this district. You are to read it and consume it. At the bottom of that same page is the vision and core beliefs. Again, you are to know them and know the core beliefs. So if someone walks in your building and asks you, nurse, do you know the core beliefs? If you don't know it verbatim, you can at least give the gist of each point so that you show that you have an understanding of those core beliefs. Now, what I told the new nurses was that they are to memorize them, which is the truth. That would be the best practice, is to memorize the core beliefs, know the mission, which is only a few words, 4 words, and know the vision. But so that you can at least repeat back those most important pieces that we have in our district. Let me tell you just a little bit about policy. Policies are determined by the state, and health services doesn't write policies. We may write a draft for policies, but at that point then it's redrafted and then it's approved by the board. So you have, because you're going to be reading policies this year. The policies come in different formats. There is a legal policy, a local policy, a regulation, and an exhibit. With legal, that is something that can't be changed. That comes from the Texas Association of School Boards. And so that comes as a result probably of a law that was changed, either in education or other areas. So that comes to the district as the first policy. Then the district has the option to write and design other policies. The next one is local. Local has to be approved by the board. So whatever that, and that's our food allergy. We have a local policy on food allergy, and it's been approved by the board during the summer, and so it's under a local policy. Then you have regulation. Regulation does not need to go before the board, but it does go to the superintendent, and he signs off on that. And then like an adjunct or an addendum as exhibits that are put on the website, which usually has different lists. Like we have an exhibit in communicable disease for reportable conditions. And so there's an exhibit there that has a list of the countries that may need to be reported, and or with TB, those countries in which we need to do TB tests, families or parents or staff coming from those countries. So those are the 4 types of policy that you will see, and again, the new one is food allergy. It's really easy to find. You go to the district website for policy, and you just type in the keyword food allergy, and 4 policies pop up immediately. They're in 4 different areas, so that you can read them and know what they are, because you're going to be affected by them as well as the students in our district. I mentioned that we have divisions now. Instead of learning communities, we have 5. 1, 2, 3, 4, 5. That's their names. 5 divisions. We have area superintendents that run those divisions, and we have a layer of executive directors. You might have seen some of that in the newspaper that came out throughout the summer as they began to identify those different administrators, those lead administrators. So, and they're set up with feeder patterns, and they're not in a geographical area. The feeder patterns are still pretty much geographical, but the actual feeder patterns that go underneath a division are not necessarily in the same area. Nurses may be traveling greater distances to be in a division to serve the students in different schools. But that is the way it is, and it affects everyone in the district. We will all be traveling probably more than what we've traveled before. In the past, we've been used to cozy little areas. You're going to one school down the street and then the other. That doesn't exist. We gradually moved away from that, but it is even more so now. And what they have done is in like Division 1, they've balanced strong schools with weaker schools. And so there's a balance within each division of those that need improvement and those that showing great teaching. So be sure that you will learn from your campus who your division is, and plus you will get communication from your supervisor that will be assigned to that division. Again, that org chart is in the bulletin. Department goals is in the bulletin. So all the department goals which affects you directly, because in showing that we have complied with our department goals, which is attached either to policy or district in some other way, the way we show that is I'm going to pull it straight from the EHR. So if a principal, an executive director, an area soup, or the superintendent, therefore at all different levels, needs that information, it can be pulled by individual school, or it can be pulled by a division, or certainly by the district. And so I will be reporting off to my supervisor, who is the executive director, Sherry Christian. She is our ED for us, and our division chief is Dr. Sylvia Reyna. So that's how we go up. We go up the same line as principals and schools do. We're in that particular overall division. So that's our chief, is Dr. Sylvia Reyna. I make an assumption that all of you have completed your CPR and AED certification. I know that your certification as a registered nurse in a school district is tied to state law, to district policy, to what expectations of this department, and to your job description. So I assume that you are up to date, and that means every year, not 2 years. Because in district policy and state law, it specifically mentions the registered nurse, along with 5 other disciplines, are to annually review their CPR skills, which is done through our CPR course that Beverly provides each year. Program standards. You are familiar with program standards. If you are not, then you will be. You will be visited by a nursing supervisor, and it may or may not be your nursing supervisor. But you will be visited by a nursing supervisor at some point during the school year. She is not evaluating you, but she's evaluating the existence of a comprehensive school health program on your campus. Does it exist? Is it there to serve the children? Are the children receiving the required services that are dictated through district policy and state law? So that's what they will be doing. It won't happen for some time yet, but that will come. And then again, I turn around and report that back to my supervisors, the outcome of those program standards. SST and ARDS, some of you are already involved in ARDS. I know the supervisors certainly are. At this point, I'd like to introduce some new staff. They're really not new staff to us, but they are in a new role. Will our special needs school nurses please stand up? We have 5. Just say your name and what division you're in. Turn around to the group.
My name's Heather Velasquez, and I'm Division 3.
It's Robbie Gelman, I'm in Division 1. Latonya Houston, and I'm Division 5. Division 4. Kathy Lanford, Division 2.
Okay, you may sit down. Thank you. These particular roles have been designed to assist you on campus with ARDS and special needs student in whether that's regular ed or special ed. They will assist in what needs to be done for those kids. They do not, in any respect, take your place. But they're there to bring extra resources and to help you prepare for ARDS, help you prepare for these special needs children. What I noticed in April of 2010, things began to change. Things have been changing over a period of time rather slowly, that we were seeing more complex needs by our students. But all of a sudden, there was a big change that occurred. And where I saw this was at PPCD. So in an effort to get a handle on that, I first went to Children's Medical Center. Some of you have heard this story before. I went to Children's Medical Center and I asked them, is my observation true? Is this correct? Am I seeing more little bitty people with trachs and G-tubes, etc., walking through our door, 3-year-olds and 4-year-olds? And they smiled and they said, oh yes, 4 years ago, we started a new protocol at Children's, and that was traching and G-tubing the NICU as these kids came in. And they were permanent trachs that went on to become permanent trachs and G-tubes, etc. So like I know, as technology becomes better and better and better, more and more children survive, and that's a good thing. But coming through our door can be a real challenge, especially if you have multiple schools and you need to be different places. Dallas, unlike some places in other parts of the United States, the children are mainstreamed. They're put in regular ed classrooms, and some are put in units. It has to be the least restrictive environment. But in preparation for these kids and to keep them safe at school, we need to be sure that we meet their needs through an IHP, through an IEP, an individual education plan that's done by the ARD committee, and through an emergency care plan. So these 5 nurses will be traveling throughout their divisions to assist you in that respect of meeting those needs. Now the supervisor is Robin Shannon. Robin, there she is. I think many of you already know Robin. And Robin was with us since October of last year, developing this new role. Unfortunately, we will not have Robin long. She is going back to the Northeast from which she came, and she will be leaving August the 31st. So that's soon. So in the interim, Darlene English is on a sharp learning curve, and she is stepping in as interim. As that position is made available, then we will post the position and fill that position. So it will be a learning curve for all of us, and we are so excited to have our 5 special needs school nurses, SN. Here, that is a term used by NASN and a national language for the particular role in which these nurses are functioning. There is a new child abuse reporting piece, again, that's in the bulletin. Immunizations, just a reminder, remember if they have health care insurance, they're to go to their provider. If they have health care insurance that does not cover vaccines or immunizations, they may go to a regular county clinic. Medication drop-off, if any of you still have medication left over from last year, we're going to dispose of it properly. And when you come to pick up your audiometer and your audiometer from MacMac this year on that same 29th and 30th, which is in the bulletin, that be sure that you bring the medication with you and be sure that it's labeled appropriately. I think an email went out regarding that, what you need to be sure and include with that medication. Our drug enforcement officer with the district will come by and pick that up. He has a special disposal site that he will take the medication to and take care of it properly. But he will keep it on hand for 90 days. And it's most important, he has the name of the student and name of the parent and phone number and address, because he will contact them and give them another chance to come in and pick up the medication. You will also be receiving, as you've had before, periodic updates from the Dallas County Health and Human Services on heat-related illnesses and on West Nile. So both are coming through to you. There is a plethora of information on the DCHHS website on West Nile. If anyone needs more information, it's easily accessed and can be pulled down for that purpose. Okay, I'm going to go ahead and give you your assignment for this weekend by Monday. You have 3 things to do. You're to go to the BON website and read Rule 225. You will also, while you were there, read the delegation packet that's on their website. In addition to that, you're to read the F policies and the district policies, which you just go in under the code and put F, and the F policies come up, and that's usually where all our health services related policies are. Additionally, in the keyword piece, you put nurse, and again hit and click it, and all the policies relating to you as a nurse will pop up. So I suppose if you do F policies, you can go in and read those specific. If you want to come back and pull the nurse, or vice versa. One can be done quicker than the other. Okay, and then finally, be sure you read the bulletin by Monday. Next week, you will be collecting H2s. I spoke with your CRCs at the elementary level, and your registrars at the secondary level. And what I told them about the new food allergy law that went into effect this summer and how it changed the H2. Now, in the past, the H2 was sent to certain groups, selected populations in schools, and it was sent at different times. That's no more. Now, starting with this year, they are to receive that H2, everyone does, because of the food allergy law that is intact. So everyone receives the H2 at least once a year. All new to district, whether they come in at the beginning of the year or they come in May, receive an H2 to fill out. The purpose of that is to collect that information, indeed, if they have a food allergy, especially if they have a propensity for anaphylaxis. And that's the group we're trying to catch and be prepared for with this new law. So they understood that. They have a copy of the H2. The H2 is also available in the Service Center if you want to order the forms. But both the English and Spanish version was provided to them electronically.